everyone, today we're going to talk about prostate cancer. Being a male puts you at risk of developing a common cancer, prostate cancer. Prostate cancer is a form of cancer that begins in the gland cells of the prostate, which is found only in males. The prostate is a small walnut-shaped gland in males that produce the seminal fluid that nourishes and transports sperm. Prostate cancer is one of the most common types of cancer. In this video, we'll explain to you everything related to prostate cancer, its symptoms, how it is diagnosed and treated. Our role today is to answer most of our questions regarding prostate cancer. Today we have Dr. Kim, who is a leading doctor at Chun Hyang University Hospital. He's going to discuss with us everything about prostate cancer from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases.
Good afternoon, Dr. Kim. Nice to meet you.
It is nice to meet you.
Yeah. We will be talking about a lot of topics today, but before we start, can you please introduce yourself?
I am Hyang from Hyang University, Seoul Hospital's Urology Department. While I attend many cancer patients, I tend to many who require minimally invasive surgeries. I am honored to meet you all.
So starting with prostate cancers, what are some of the first signs of prostate cancer?
Lately, prostate cancer usually is discovered at the initial stage. Many do not have any special symptoms. Many patients are confused about benign prostatic hypertrophy, BPH, and prostate cancer. BPH is not cancer, but a benign overgrowth of prostate tissue and can be uncomfortable during urination. But it is not cancer. There are cases when BPH and prostate cancer occur simultaneously. But the discomfort symptom is from BPH and not from cancer, as the cancer does not have a unique symptom.
So what are the kind of surgeries you do to treat the prostate cancer?
Recently, robotic surgery is the norm in prostatic cancer treatment. While the procedure started in the USA, Korea quickly caught up and is available at many hospitals. While every doctor has his or her specialty, if I were to add about my strengths, I am doing surgery that closely matches the need of the patients in terms of preserving as much as possible of the prostate's function.
So other than surgeries, what are some other methods out there?
Aside from surgery, one can choose from many radiation therapies, some of which many doctors do not know as the methods have advanced quite a bit lately. Urination is important and the treatment depends on the condition of the urination ability. As much as robotics have helped to the advanced surgery method, radiation therapies have advanced a lot.
Dr. Kim, what is the likelihood of reoccurrence in the case of prostate cancer?
After treating prostate cancer, there are two major ways reoccurrence happens: biochemical reoccurrence and clinical reoccurrence. In the biochemical reoccurrence, only the biomarker, PSA, gets elevated without any particular need for treatment. At times, 10 to 20% fall under this category. In clinical reoccurrence, the cancer can actually be visually detected with a CT scan or MRI. In this case, follow-up treatment is needed, which is about 10% of cases or less. But more important than these statistical facts, it is more important to know the characteristics of the patient's prostate cancer. While two different patients may be equally having prostate cancer, one patient may have had a very high PSA level, or if the cancer was especially severe, the reoccurrence likelihood is much higher.
So for alcohol and smoking, how much does it affect prostate cancer?
Environmental factors are not that big for prostate cancer. Similar to breast cancer, liver cancer, and lung cancer, prostate cancer has strong genetic factors. So alcohol has a direct relationship to liver cancer. Smoking is related to lung cancer and bladder cancer, but for the prostate cancer, there is yet no verified link to it. But smoking is a dangerous factor to all cancer, so it is best not to smoke. Yet more important than environmental factors, genetic factors play a large role relative to all other cancers.
Today we learned many things about this disease and the doctor explained in details everything related to prostate cancer, such as its symptoms, diagnosis, and management. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.